Now, public health experts are warning that rich countries are moving to stockpile monkeypox vaccines, which could leave millions of people in Africa exposed to a more dangerous version of the disease. More than 22,000 monkeypox cases have been reported in nearly 80 countries since May, with about 75 suspected deaths in Africa, mostly in Nigeria and Congo. Outside the continent, Spain has reported 2 deaths, and there's been 1 in Brazil. The producer of the most advanced vaccine, Bavarian Nordic, can deliver around 30 million doses a year, with about 16 million vaccines available now. Scientists say targeted vaccinations will prevent monkeypox developing into a pandemic. That's not stopped the US from ordering 13 million doses. Spain, which has Europe's biggest outbreak currently, is administering just over 5,000 doses, with concerns that won't cover the groups most at risk. And even though monkeypox has been endemic in Africa for decades, it's the only region in the world without vaccines. So I'm now pleased to be joined by Asia Russell. She heads Health Gap, an international organization that helps HIV sufferers get access to medicines. She is in Montreal, the 24th International AIDS Conference, and joins me now. Why are African nations not getting this vaccine first?
Frankly, the same mistakes of the AIDS pandemic and the COVID-19 pandemics are being repeated in real time with vigor by wealthy countries. They're hoarding vaccine. They're standing in the way, frankly, of policy shifts that are urgently needed to scale up production of vaccines, tests, and treatment. And the lessons have not been learned by Joe Biden, by Justin Trudeau, and other political leaders who have the power today to prevent further catastrophe, further brutal inequities in access to these essential public health interventions. There's no need to hoard them in the wealthiest countries among the most privileged populations, but that's precisely what's taking place now.
And what does that mean for the continent that's been hardest hit by this disease? They've seen more infections than any other part of the world. The risks are much higher. And then also it's a much broader geographical spread. So, you know, what does that mean if richer countries are going to the market and scarce?
Unacceptably, communities in need are once again being pushed unnecessarily to the back of the queue. That's preventable. It's only preventable when global leaders like President Biden stand up, take leadership, and learn the mistakes of the COVID pandemic by compelling the immediate expansion of production of monkeypox vaccines, tests, and treatment, and ensuring equitable distribution, working hand in hand with the WHO and with the other countries that are frankly hoarding these supplies right now. That's unacceptable. And we have to challenge. President Biden, when he was a candidate, expressed that he wanted to ensure that the U.S. would be an arsenal of vaccines for the world. And he's showed a political prioritization that takes exactly the opposite route. And that has to stop with monkeypox. So he has a chance to declare a state of public health emergency in the United States. That's exactly what he must do. And to take a step further and stop repetition of the brutal inequities of COVID-19 access to vaccines, treatment, and test in the case of monkeypox. It's not too late, but very soon it will be too late.
Speaking of inequities, I wanted to ask you about the HIV conference that you are attending, and ironically branded a chance for the world to be able to come together, thousands of scientists and social workers, doctors, to be able to exchange ideas and knowledge. There's been a lot of frustration over visa issues. Just explain to us what's been happening.
Miriam, it's an outrage. The government of Canada's racist immigration policies have meant, and it's been decried as racist from the stage of this conference by researchers and scientists. It's meant the world's top people living with HIV, activists, scientists, and researchers have been barred entry from this scientific conference. And, you know, the government of Canada didn't even have the bravery to show its face at the opening ceremony. It was hiding. And it's a cowardly move for a country that has yet to commit to the Global Fund to fight AIDS, tuberculosis, and malaria on the occasion of its replenishment. So immediately the country has to repair that harm by making a $1.2 billion commitment to replenish the fund and to apologizing for this shameful and frankly racist immigration attitude and approach. And the International Aid Society should cease having these meetings in countries that have similar policies immediately. There's no time to waste for hot air around decolonization when the proof is clearly here that the government of Canada talks the talk on inclusion but is refusing to walk the walk.
All right, thank you for joining us. Asia Russell, Executive Director of Health Gap.